Understanding nerve damage in your back starts with the basics. Your back is a complex structure, supporting your body every single day. Inside your back, there is a spinal cord, which acts like a main highway for messages traveling between your brain and your body. Nerves branch off from this spinal cord, known as nerve roots, and they go to different parts of your body. These nerves carry important signals that help you feel sensations and move your muscles. Understanding this system is the first step to understanding back problems better. Nerve damage in the back means something is wrong with these nerves. Perhaps they are irritated, compressed, or even inflamed. This damage can interfere with the signals, causing messages to not travel correctly, leading to various uncomfortable symptoms. Many people experience some form of back pain, but nerve damage pain has specific qualities. It's important to know what can cause this type of damage. One common cause of nerve pressure is a herniated disc. Your spine has discs between the bones or vertebrae that act like little cushions with a soft, gel-like center and a tougher outer layer. A herniated disc occurs when the soft center pushes out through a tear in the outer layer, pressing on a nearby nerve root. This pressure is often blamed for pain, although many people have herniated discs and feel no pain at all. Another condition often mentioned is spinal stenosis, which means narrowing. Spinal stenosis is a narrowing of the spaces within your spine that can put pressure on the nerves traveling through the spine. This can happen in the spinal canal where the cord is or where the nerve roots exit. Spinal stenosis often develops slowly over time and is more common in older adults. Again, many people show signs of stenosis on scans yet live without significant pain. The body is resilient. Many people suffer from back pain that just doesn't seem to leave. They try treatments, rest, and see doctors, yet the pain persists. This can be very frustrating and make you feel hopeless. Why does this happen? One reason is that the true cause of the pain is often missed. The focus might be too much on what scans show, like herniated discs or stenosis, which are common even in people with no pain. Sometimes the diagnosis might be incomplete, focusing only on the physical structures, looking for a tear, a bulge, or some narrowing, without considering other crucial factors. Chronic inflammation plays a big role in persistent pain. Inflammation is your body's natural response to injury or threat, but sometimes this response becomes chronic, staying active for too long and keeping nerves irritated. Tension, stress, and worry can fuel this chronic inflammation, making your emotional state matter greatly. Another important concept is central sensitization, where your nervous system becomes overly sensitive, like the volume knob for pain gets turned up too high. Normal sensations might be felt as painful, and pain signals get amplified. This can happen after an injury or due to ongoing stress or emotional distress. Your brain learns to expect pain and becomes very good at creating the sensation of pain. This is a very real physical process, not all in your head, but your brain is certainly involved. Scar tissue can sometimes form after an injury or surgery, which is less flexible and could potentially tether or irritate nerves. However, the body is designed to adapt, and the presence of scar tissue does not automatically mean endless pain. Often, the fear of re-injury or the belief that the scar tissue is the sole problem maintains the pain cycle. A lack of a multidisciplinary approach can also hinder recovery. Treating only the physical without addressing stress, fear, or unhelpful beliefs often leads to poor outcomes. A broader view is needed. How do you know if your back pain involves nerve damage? There are certain signs to watch for. The type of pain is often a clue. Nerve pain is frequently described as shooting pain, like an electric shock or a burning sensation. This pain often travels, radiating from your back down your leg, commonly known as sciatica if it affects the sciatic nerve. The pain can be sharp and intense, different from a dull muscle ache. You might also experience changes in sensation. Numbness is a common symptom of nerve involvement, feeling like a part of your leg or foot has gone to sleep. Tingling, or a pins and needles feeling, is also typical. These sensations can occur in specific areas depending on which nerve is affected. For example, if a nerve in your lower back is compressed, you might feel numbness in your calf or foot. These sensory changes are important indicators that a nerve might be struggling. Changes in muscle strength or function can also occur. You might notice weakness in one of your legs or find it hard to lift your foot, sometimes called foot drop. Difficulty with certain movements, like stumbling more easily or finding it hard to push off with your toes when walking, can be a sign. These motor symptoms suggest the nerve signals to your muscles are being disrupted. It's important to pay attention to such changes as they provide valuable information about nerve health. Recognizing these symptoms is crucial to differentiate nerve-related pain from simple muscular back pain. If you experience these signs, it is wise to consult a healthcare professional, especially if symptoms are severe or worsening, or if you experience changes in bowel or bladder function, which can be a sign of a serious condition. However, remember that the presence of these symptoms often creates fear, which can amplify the pain and make recovery harder. Understanding this is key. Many people with nerve damage wonder if they will ever get better. Can these damaged nerves in the back actually heal? The answer is complex. Nerves do have a capacity for healing and regeneration, especially peripheral nerves that branch out from your spinal cord to your limbs and body. The central nervous system, which includes the brain and spinal cord itself, has a more limited ability to repair. Most back-related nerve issues involve peripheral nerve roots, which offers some hope. Several factors influence nerve recovery. The severity of the nerve damage is important. Mild irritation or compression often resolves well, while more severe damage, like a nerve being cut or badly crushed, is harder to heal. The duration of the compression also matters. Nerves that have been under pressure for a very long time may recover more slowly or incompletely. Your overall health plays a role too. Good circulation, proper nutrition, and managing conditions like diabetes can support nerve healing. Age can also be a factor. The body has its own processes for nerve repair. If a nerve fiber is damaged but its protective sheath is intact, it can often regrow, although this regrowth can be slow, perhaps a millimeter a day. It requires the right conditions, including good blood supply to bring nutrients and oxygen, and the absence of ongoing irritation or compression. Importantly, chronic tension and stress can reduce blood flow, creating an internal environment that is less conducive to healing. This is a critical point often overlooked by purely mechanical views. So, what are realistic expectations? Not all nerve damage can be reversed completely back to normal. Sometimes, there might be some lingering numbness or weakness. However, significant improvement is very often possible. Many people can achieve a great reduction in pain and regain much of their function. The focus should be on functional recovery, meaning being able to do your daily activities with more ease. Your mind plays a powerful role in perceived recovery. Believing in your body's ability to heal is paramount. Section 5. Fueling your nerves. The power of anti-inflammatory nutrition. What you eat can have a real impact on your body's inflammation levels. Chronic inflammation is a known enemy of nerve health. It can irritate nerves and worsen pain signals. Therefore, adopting an anti-inflammatory diet can be a supportive strategy. This is not a cure on its own, but it can help create a better internal environment for your nerves. It helps your body manage inflammation more effectively. Think of it as giving your body the best tools to fight back against irritation. Certain foods are known for their anti-inflammatory properties. Omega-3 fatty acids are very beneficial. You can find these in fatty fish like salmon, mackerel, and sardines. Walnuts and flax seeds are also good sources. Colorful fruits and vegetables are packed with antioxidants. These compounds fight oxidative stress, which is linked to inflammation. Berries, leafy greens, broccoli, and sweet potatoes are excellent choices. Whole grains, like oats and brown rice, can also help. They provide fiber and steady energy without spiking blood sugar. On the other hand, some foods can promote inflammation. It is wise to limit or avoid these if you are dealing with nerve pain. Processed foods are often high in unhealthy fats, sugar, and artificial additives. These can trigger inflammatory responses in your body. Sugary drinks and refined carbohydrates like white bread and pastries can also be problematic. They can lead to blood sugar swings and contribute to inflammation. Trans fats, found in some fried foods and baked goods, are particularly harmful. Reading food labels can help you make better choices. Do not forget the importance of hydration. Drinking enough water is essential for overall health. It helps your body flush out toxins. It also keeps your tissues, including those around your nerves, healthy. Aim for consistent, healthy eating patterns rather than extreme diets. Small, sustained changes are more effective in the long run. Remember, nutrition is one piece of the puzzle. It supports your body's healing efforts. It works best when combined with other strategies for managing nerve pain and addressing its underlying causes, including tension. Section 6. Moving towards relief. Physical therapy and exercise for nerve health. Physical therapy and exercise are often recommended for back nerve problems. The goal is not just to fix a supposed structural issue. A good therapist understands the bigger picture. They aim to reduce pain and improve function. They also work to restore your confidence in movement. Fear of movement is a huge barrier for many people with chronic pain. Gentle, appropriate exercise can help overcome this fear. It teaches your brain that movement can be safe and even helpful. This is a crucial step towards recovery. What kinds of exercises are typically helpful? This will vary depending on your specific situation. However, the focus is usually on gentle approaches. Specific stretches can help to relieve pressure on nerve roots. Core strengthening exercises are also important. Strong abdominal and back muscles provide better support for your spine. This can reduce strain on discs and nerves. Nerve glide exercises, also known as neural mobilization, are sometimes used. These are gentle movements designed to help nerves move more freely within their surrounding tissues. Consistency and proper form are key when exercising for nerve health. It is not about pushing through severe pain. That can actually be counterproductive. It can increase fear and tension. A physical therapist can guide you on the correct exercises. They can teach you how to perform them safely. Starting slowly and gradually increasing activity is usually the best approach. Listen to your body. Some discomfort when starting a new exercise program is normal, but sharp or increasing pain is a sign to modify or stop. How does movement help? Exercise improves blood flow to the affected areas. This brings oxygen and nutrients that support healing. It can help reduce inflammation. Specific movements can gently decompress nerve roots. Perhaps most importantly, regular movement helps to retrain your brain. It reduces the fear avoidance cycle that traps so many in chronic pain. When you move without catastrophic consequences, your brain begins to unlearn the pain response. You start to trust your body again. This mental shift is often as important as any physical change. Section 7. Beyond the basics. Supplements and emerging hope for nerve repair. When dealing with persistent nerve pain, many people look for additional help. Supplements are often considered. Certain vitamins and compounds are thought to support nerve health. B vitamins, for example, play a role in nerve function and repair. Vitamin B12, B6, and B1 are particularly noted. Alpha-lipoic acid is an antioxidant that has shown some promise in studies for reducing nerve pain, especially in conditions like diabetic neuropathy. However, it is important to be cautious. The evidence for many supplements specifically for back-related nerve damage is not always strong. Magnesium is another supplement that often comes up. This mineral is involved in hundreds of bodily processes. It plays a role in muscle relaxation and nerve function. Some people find that magnesium helps with muscle cramps and tension. Since tension can exacerbate nerve pain, reducing it might offer some relief. Again, it is best to discuss any new supplements with your doctor. They can advise on appropriate dosages. They can also check for potential interactions with any medications you are taking. Supplements are not a replacement for addressing the root causes of pain. There are also emerging treatments that offer hope for nerve repair. Low-level laser therapy, also known as cold laser therapy, is one such option. This therapy uses specific wavelengths of light. It is thought to reduce inflammation and promote tissue healing, including nerve regeneration. Some studies have shown benefits for certain types of nerve pain. Regenerative medicine approaches like platelet-rich plasma injections or stem cell therapy are also being explored. These are generally considered experimental for back nerve issues. More research is needed to confirm their effectiveness and safety. It is natural to seek out new solutions when you are in pain. The power of belief in a treatment can also be significant. This is known as the placebo effect, but it is a very real effect. Feeling proactive and trying something new can itself have a positive impact on your pain experience. However, always approach new or emerging treatments with a degree of healthy skepticism. Do your research. Consult with trusted healthcare professionals. The most powerful treatments often involve understanding the mind-body connection and reducing the tension that fuels so much chronic pain. Section 8. Embracing a holistic path, mind, body, and hope in nerve pain management. The journey to relieve nerve pain in the back is rarely a straight line. It often requires a broader perspective. The mind and body are not separate entities. They are deeply interconnected. This is especially true when it comes to chronic pain. Your thoughts, emotions, and beliefs can profoundly influence your physical sensations. Stress, anxiety, fear, and unexpressed anger can create and perpetuate physical tension. This tension can restrict blood flow. It can sensitize your nervous system. It can make your body more prone to experiencing pain, even from normal physical findings. Mind-body techniques can be incredibly powerful tools. They help to calm the nervous system. They can reduce the fight or flight response that often accompanies chronic pain. Mindfulness meditation teaches you to observe your sensations without judgment. This can help you detach from the pain and reduce its emotional impact. Deep breathing exercises can activate the body's relaxation response. Techniques like yoga or Tai Chi combine gentle movement with focused attention. These practices can reduce tension, improve body awareness, and promote a sense of well-being. Knowledge is also a powerful medicine. Understanding the true nature of your pain can be liberating. Many people with chronic back and nerve pain have been told their bodies are damaged or degenerating. This creates fear. It makes them guard their movements. It makes them expect pain. Learning that common structural findings are often not the primary cause of chronic pain can be a revelation. Understanding that tension and learned neural pathways play a huge role can shift your focus. It can empower you to take control by addressing these underlying factors. Please do not lose hope. If you are struggling with nerve damage in your back, there are multiple avenues for relief. There is no single magic bullet. But by adopting a holistic approach, you can make significant progress. This means addressing the physical aspects with sensible movement and nutrition. It means considering supportive therapies. Crucially, it means acknowledging and addressing the powerful influence of your mind and emotions. Be an active participant in your recovery. Seek knowledge, reduce fear, reassure yourself. Improvement is possible, and you can reclaim a fuller, more comfortable life. Subscribe to our newsletter for more health tips.